Welcome to the Internal Medicine program at the University of Kansas Medical Center. My name is Luke Frankel, and I'm one of the chief residents. 4 short years ago, when I was in your shoes, things were a lot different. We were able to come to Kansas, tour the medical center, and get a feel for some of the people and some of the amazing medicine that's being done here. I know that you will be unable to do that, but hopefully through this video, you will be able to get that same feel that I did, and hopefully make Kansas your next home. The University of Kansas Health System is a 1,045-bed quaternary care center with 196 adult ICU beds divided between 3 main hospitals. While all 3 towers house general medical wards, each provides its own unique flavor. Bell Hospital is home to 3 medical ICUs. Heart Center's 9th floor is our cardiac ICU, where our heart failure and general cardiology services operate. Cambridge Hospital is home to our hematology and oncology teams and gives our residents the best views on these trying services. All of our hospitals are connected to our covered parking garage, so even on the dreariest days, you'll have a pleasant walk into work to grab your free cup of coffee.
Hi, I'm Stacy Carlson, one of the internal medicine chiefs. One of the strengths of our curriculum at KU is the inpatient hospital experience. We rotate at 2 hospitals, including the Kansas City VA and the University of Kansas Health System. We cap our teams at 16 patients, meaning that you never have to care for more than 8 patients as an intern. This leaves time for you to focus on providing the best patient care that you can and your own personal medical education. At KU, we have 3 inpatient general medicine services. We also feature a primary hematology and oncology service. We're nationally ranked in hematology and oncology, and as a quaternary referral center, we see some of the rarest and most aggressive malignancies. This ensures that you'll be able to practice in any field and at any location in your future career. In addition to our general medicine experience, we also care for patients in the medical ICU and the cardiac ICU. Our medical ICU has a high volume of patients, meaning that you'll get plenty of procedure experience and experience caring for the decompensating patient. Our cardiac ICU is unique in that we care for patients pre and post cardiac transplant. We also care for patients with left ventricular assist devices to make sure that you get a well-rounded cardiology experience.
Hi everyone, I'm John Logan. I'm one of the internal medicine chief residents at the University of Kansas, and I want to talk to you today about our outpatient training. I'm currently in the medical office building in a clinic pod where we spend 4 half days every +1 week in continuity clinic, as well as subspecialty clinics where we can further define our career interests. During our +1 week, we also have the ability to undergo additional simulation training, board prep time, as well as procedural training where we can work with interventional cardiologists, interventional radiologists, pulmonologists, and IV therapy team to further define our procedural skill set. Let's check out a patient room. So this is a typical examination room. Each room is equipped with a computer that allows you to focus on patient care as well as efficiency. Each computer is telehealth enabled to allow you to develop a vital skill set in a post-COVID world.
Welcome to our Kansas City VA. It's a 250-bed acute care hospital located about 10 minutes away from our university campus. As a resident here, you can expect to spend about 30 to 40% of your time here versus our university hospital. We have 4 inpatient general medicine teams, 1 medical ICU team, and 1 inpatient cardiology team. You can also expect to rotate through our multiple consult services in many different subspecialties.
One of the best parts about our program is the strong educational experience you receive. Each day over the noon hour, you're able to attend a separate lecture. These lectures include case conferences led by our residents with the assistance of faculty, expert faculty conferences, clinical pathologic and patient safety conferences, ethics and statistics conferences. While we feel it is vitally important that our residents get this global education, we also give you an opportunity to individualize your training. This can be done by following one of our separate pathways. Our pathways include hospitalist medicine, primary care, research, quality improvement, global health, and clinician educator.
So in addition to our didactic curriculum, we have the ability to train in a state-of-the-art simulation center known as ZEAL. This allows us to be able to encounter and work with anxiety-provoking but common diagnoses that we can work through prior to seeing them in real life. Some of our current curriculum includes a 4-part central line insertion, a tachy and bradyarrhythmia section, a code blue simulation where we work with critical care nurses, as well as end-of-life training so that we're all prepared for when the time comes.
When I get asked why I chose KU, truthfully the answer is quite simple. I had no other options. No, in all sincerity, when I rotated here as a medical student, I came to the realization that institutions don't teach people, people teach people. I felt like as a medical student, and it remains true now as a resident, that the hierarchy here is very flattened and the attending physicians make themselves available for things such as bedside teaching with point-of-care ultrasound or teaching physical exams at the bedside. The second thing that I think is really special about KU is the medical complexity. Most people don't realize that KU is over a 1,000-bed hospital with medical complexity that can rival anywhere in the country.
It's just not Kansas anymore, Dorothy.
So this is a typical examination room. Okay, roll it again.
We get some of the most rarest and aggressive cancers.
Hey Luke, I love you a lot. You're my best friend.
I'm Stacy Carlson, one of the, don't know what I am.
I work with interventional pulmonologists, interventional cardiologists, pulmonologists.
Can't even say that anymore. I'm losing my mind. Dish to dough, that's not good.
Close! So close! Praying and procedures. What did I say that first
Why
time?
did you do a triage out?
I don't know. I don't know. We're not
Just keep going.
I'm losing my mind.
Pathologic conferences and some other conferences that I can't think of right now.
We have patient conferences, safety conferences.
Dish to dough, that's not good.
Patient safety as well as what?
That's all I can do.
That was good.